At all. But before we actually start rolling those pictures, I mean, how do you decide whether to perform a breast augmentation, a lift, or maybe even both?
Okay. It really depends on the anatomy of the patient. If the patient comes in and her breasts look more deflated, but they've kind of maintained the shape, and what I mean is that her nipples are actually in good position, they're above the very bottom of the breast, then all she may need is an augmentation. That means only implants without anything else. But if her nipples are starting to point low or her breast tissue itself is starting to droop, then she may need a lift in addition to an augmentation. And there's a very simple test. It's called a pencil test that a woman can do at home. She can stand in front of the mirror and place a pencil underneath her breast, and if it holds, that means her breasts are too low.
Okay, now we're talking about not the sharp side, people. This is just the
this is a flat part, the flat part of the pencil.
Okay.
It's called, so if they fail the pencil test, then they probably need a lift.
Okay.
And if they pass the pencil test, then all they need is an augmentation. And then some women need a lift in addition to an augmentation. That depends. If they want to be fuller than what they are, then they need a lift and an augmentation. And if they're happy with their size and just want to improve their shape, then all they need is a lift.
All right. Well, there's only so much Victoria's Secrets can do, right? Let's get a look at some of the before and after shots of the mommy makeovers, just to describe what happened here. Okay. This is someone. Is that just an augmentation?
Yeah. So this woman, also a new mom, and after pregnancy, you can see that the upper pole of her chest is flatter, and her breast mostly concentrates in the bottom half of the chest, and so all she's had is a augmentation.
Okay, and nothing with the tummy? She was able to spring back?
Some of it is that, yes.
Well. Okay, next picture.
So same thing. This woman, again, is a classic example of just an augmentation. So during her pregnancy, she actually, she had twins, nursed very well, had a lot of milk to nurse, and then afterwards she had the complete deflated breast. And so there is an augmentation after.
I guess this begs the question, would a woman be able to breastfeed after an augmentation?
It really depends on where the incision is made. If a woman wants to nurse after having her augmentation, she should have the incision placed away from the nipple area. So the other two areas would be maybe underneath the breast or through the armpit. And so this way you actually don't cut through any milk ducts, you don't cut through any breast tissue, so it really doesn't interfere with amount of milk production or the milk actually coming through.
Now, whereas if you do the lift, you might be cutting some of the
So
glands.
anytime incisions are placed in and around the nipple or the nipple is moved, you could potentially affect the amount of milk production after the surgery.
We're looking at another picture. You want to describe
this is another woman who's also had some droop of her breasts, and all she's had is an augmentation.
And that's it, huh?
Yeah.
Now, did that restore her to her previous size?
She actually wanted to go a tiny bit larger, so it's a little bit more. She's got a little more upper pole fullness than she had previously.
Okay. And